I'm Dr. John Heim. I'm board certified in general and thoracic surgery, and I'm the chair of the Department of Surgery at Penn Medicine Princeton Health. Today I'm going to talk about the rising rates of lung cancer among women. Lung cancer remains the #1 cause of cancer deaths in the nation. According to the American Cancer Society, higher than breast, colon, and prostate cancers combined. And there seems to be a particular risk for women, whether they have a history of smoking or not. A study reported by the American Cancer Society shows that women between the ages of 30 and 49 are being diagnosed with lung cancer at higher rates than men of the same age. The reason behind this rise is unclear. Most lung cancers relate to a history of smoking, and for many years, smoking was thought to be a male phenomenon. That has changed over the years, so it is possible that that could play a part in those findings. Both men and women who have a history of smoking are at higher risk. This includes smokers or former smokers age 50 or older with a 20-pack year smoking history. This means 1 pack a day for 20 years or 2 packs a day for 10 years. But remember, the most important thing is people that have had a history of smoking are at increased risk. Women in their 50s and 60s who have never smoked can be diagnosed with lung cancer. They exhibit a very distinct form of lung cancer, however, that presents itself as a cloudiness in the lungs rather than a solid tumor. Usually this is found during an unrelated test, for example, a calcium coronary artery screening, where an imaging is done around the lungs, or a chest x-ray. There are no specific guidelines for who is at risk for this type of lung cancer, although women who have had breast cancer do seem to have a higher incidence of this. For both women and men, signs of advanced lung cancer include prolonged coughing, shortness of breath, chest pain, coughing up even a trace amount of blood, headache, and hoarseness. People who experience any of these symptoms that I have described should have a diagnostic CT lung screen. Individuals who are over the age of 50 or at risk for developing lung cancer due to their smoking history or genetic factors should be tested with low-dose CT lung screening. This should be done on an annual basis until about the age of 80. For women whose cancer presents as a cloudiness in the lungs, options include regular testing to check for changes in the condition or a biopsy and removal if needed. For women whose tests reveal a distinct tumor, their treatment plan may include surgery, chemotherapy, radiation therapy, or a combination of these 3 options. If you're experiencing symptoms, you should see your doctor for a diagnosis and treatment. When it comes to lung cancer and many other types of cancer, early detection is critical to developing an effective treatment plan. And remember, lung cancer caught early and treated with surgery is often cured.